All right. Welcome back to Influential Dental, the podcast that's bringing guests from around the world, some of the most influential people in the dental space. And we are so excited about our guests today. I'm Julieanne O'Connor. I'm here joined with my co host, Michael Keeter. And we have extraordinary guests, which we can't wait to introduce to you, Dr. Haley and Dr. Goly, who are the vVardis sisters from vVardis, the company, not their last name, by the way. And we are so excited to have you. But before we jump in, we have so many questions for you. Mike, how are you today?
Excellent, Julianne. Greetings from Phoenix, Arizona, and I look forward to really talking with two amazing guests as well, Julianne. What a phenomenal story and products. And so this will be an amazing talk and great to see you this morning, Julianne. Thank you.
Thank you. Dr. Haley and Dr. Goly, thank you so much for joining us. Tell us, where are you right now? Where are you tuning in from?
Well, first of all, I want to also thank you for having us. We are excited
Yes.
being on your podcast today. We're actually in Switzerland now in our office in Zug. And this is actually rare because usually now we are mostly in US. And let me show you just out of the office. This you see. This is
Beautiful.
Beautiful.
Yeah,
with the
Haley's
lake of
sitting
Zug.
in the office. We actually share the office together but I'm now sitting to her in the meeting room. So this is my view also.
Love it. That's amazing. Well, we can't wait to just hear a little bit about your journey. So, you have, first of all, created this incredible enterprise where you have built these reputations that are so extraordinary because you're some of the nicest people, a couple of the nicest people we've ever met in the
Well,
industry. And you're
thanks so
so humble.
much. This is so kind.
No, genuinely. And we've seen you on stages all over. You've created this massive thing. And a lot of times people just see this huge success, which you have definitely created. But you also represent lifestyle. I mean, you show up, you walk the part, you care so deeply about people and about what you've created. There's so many things we can unpack today. But give us just a little glimpse into your background and how you sort of came here and got where you're at as doctors in dentistry. How did you end up here creating products?
Thanks so much, Julian. So maybe I began, Goly and I, we both studied medicine and dentistry. And knowing how important oral health is for the overall health, we wanted to make an impact. And that's why we decided to treat children to make an impact in their overall health. And that
Yes.
was a long time ago.
Yeah, and the reason why we actually want to start with medicine was because for us what's important, if we do something, we want to have an impact on people's lives, because we had very important role models in our lives, Haley and I, our parents. So our mom, as also an entrepreneur, who always told us the highest achievement in your life is to make people happy. So this is why we decided. And then in Switzerland, you first study a couple of years medicine, and there we found also and understood the importance of the mouth for the whole body. And this was the reason we decided to then study dentistry. And we wanted to make an impact, especially on children in the beginning. That's why we led together. This was how we started, actually. Haley and I working together many, many years ago, and we're still working together, which is actually a good sign as sisters. Also sometimes challenging, but I think that's all of you know.
Oh, I
That's behind
bet.
the doors.
Hey, no, Mike and I are like brother and sister, trust me. So we
Yeah.
understand, but we always say friends first, right?
Right.
Yeah.
So let me ask you, because I mean, obviously you guys have been working, and for our listeners, just for the record, if you are tuning in and you're not watching the video, make sure you find the video too, because these ladies look like they just started this because they look like they're 22 years old.
No.
But you guys are so gorgeous. And so it's so always so funny for me to hear you've been in business so long and all of these things. But your mom was an entrepreneur. What did your mom do that was entrepreneurial? Was she in dental or was she in something else?
No, she did actually institution for English. It's the first Yes. So a school, and we remember in our days where we helped her in marketing to put all these flyers around and going around the town and spreading the flyers around for her. And our father, a scientist, and he
Yeah.
always told us, Mother Nature knows the best.
Yes, and our mom also always told us, if you have a vision, then go for it. No doesn't exist. You have to work very hard for that if you really want it. And at the end, if it has an impact on people's lives, this is something beautiful that you have to just go for it. So I
Yeah.
think that's the
It's
drive that
I
she
love
gave us.
this. Amazing. I can see already that our listeners are everybody should have a pen and paper because I can
Uh,
see everybody should be you guys
oh,
are
you're so
dropping these
kind.
gems
You're
already
so
and we're just
kind.
starting.
Thanks so
Yes.
much.
You're giving us so much energy with this kind words you're saying. Thank you so much, both of you.
No, that's amazing. And I want to just reiterate what Julianne's saying and what I'm feeling and hearing as well, because I'm very energized by this conversation as well. And again, you're talking about children, which are near and dear to my heart and Julianne's heart. If people don't know, Julianne is adopted many children and has a lot of causes for children. And the fact that you guys are studying and working and progressing for children's dentistry is amazing because they only are young once and then they have to live with their dentition in their lives moving forward. So I guess I want to really commend you both and your company on really leading for dentistry and children first and foremost. So thank you on that. And and also those role models that you speak about as well, and that your parents, and that you're motivated. And you talk about them as some of your early mentors. And before we get into a little more on the dentistry part, let's stick along those lines around mentors and what drives you all. Obviously, you've had different mentors that have been influential in your lives as well. Can you share a little bit more about some of those mentors and influencers early on in your career, and maybe currently with you now?
Yeah, I think the biggest mentors is our parents. And since we have the same parents, we had also always the same vision and the same mission. And the other mentors, I would say, our patients. So the children were our mentors in the beginning, where we really learned what is their need. And this helped us also to understand the need also of the adults. And then also the homeless people that we treated were also our mentors, where we have found out also the importance after we treated them for free and gave them their smiles back, how we saw how their lives changed and how they suddenly really started to stop with the drugs, stop looking for new jobs. They got socialized again with the family, and this was something very emotional. So what we are doing, our journey with vVardis, is a very personal thing for us.
And what is also during our studies and also during our whole journey, treating these children and also creating actually the first DSO in Switzerland and the first fear-free DSO in Europe, which we went also globally, bringing the brand to other countries like India, Brazil, Tokyo, all around the world. That was actually, you won't believe it, is someone who 140 years ago in Chicago, during a lecture, said, one day there will come that we will not do any more invasive restoration. We will have something else. And that was Dr. G.V. Black. And he was someone that we always said, if we would have something that would take a bit more fear away, and the patients would change their mindset and come themselves to the dentist to check soon enough without pain and not wait until they have a problem, then we have found it. And interesting enough, why I'm saying this is what gave us goosebumps. That was about 2 years ago, where we went to Chicago to see his statue and make a picture. And we had there already since 3 years vVardis, which comes from our name, Abivardi. So you have the two Vardi, vVardis. And when we wanted to take a picture from him, the one who we always follow, we saw under his statue his full name. And his full name was Dr. G. Vardy Man. So also Vardy. And there we said, oh my God, sometimes maybe it's not coincidence. We were following his legacy since so many years. And with vVardis, we're actually bringing a technology here which can treat now cavities non-invasively without a drill.
And
which he
his
predicted.
last publication we just also found out was about we have to treat enamel. Everyone is focusing on dentin, but actually we have to focus on the enamel. And that's
That's
what we're doing now.
amazing. So you guys, this, I mean, I'm so inspired right now. So oftentimes we have this vision, right? And then there's no idea of how. Like, what are we going to do? Like, how are you going to create a product? Nobody had ever done it before. You guys are the first to do it. Still, to my knowledge, there's nobody else doing anything like it, creating a product that is this altering in this industry. It is shift completely the
Yes.
industry, and it's disrupt, and it's beautiful, and it's got such a
Thank
profound
you.
effect. I mean, when you got that vision, did you at first say, well, that's going to be impossible? Or were you always, because you were so inspired by your parents, just like, we're going to figure it out. We're going to find a way. Was there ever a doubt that you could come up with something like this?
Well, doubt in our life is a lot of times. And a lot of times really down where you don't know how to get up again. But this is normal. So
Yeah.
this, yes.
Roller coaster is normal as entrepreneurs. And that's what we teach also our team. They say what they learned from us is that whatever happens, we will find another way and there will be another window opening that we can go there. And yes, we were always searching for technology which could improve the oral health of our patients. And so next to accessibility, as Haley was saying, the DSO that we founded from scratch, we also run our own dental hygienist school for early interventions, so always focusing on improvement of oral health of the population. We also were able to, together with the health department in Switzerland, we could convince them to legalize marketing. This was
In
many
healthcare,
years in healthcare
it was forbidden.
I
because and
remember hearing this. This is
yes,
crazy.
so many patients, they came too late to us. So how could we? It's not to have clinical success. The patients also have to come early enough. So that's why we could convince them. And so did the first campaigns, awareness campaigns in Switzerland. And we also had our clinical research department in combination with also our hygienist school, where we kept doing clinical testing, and there where we discovered this amazing technology. And we followed this so many years, and we said it was for us like a dream coming true. When we
Did,
saw what this does, it was really the gap which was missing. It was not doing until today, there was always prevention or invasive treatment. And suddenly we found something in between.
And that was also what we said, as Goly said, this treatment gap in dentistry, which for these small cavities, there was no real treatment until today. Because, I mean, as long as it is like 25 micro still the carries in the enamel. You know that fluoride varnish as gold standard of prevention can rebuild again the tooth, remineralize it. But as soon as it goes deeper in the enamel, and the enamel goes until 2000 micro inside, and it's still enamel early stage, we knew prevention has failed. That means when we see it already in enamel on X-ray, it's already too late for prevention. So what could we do? Drill it, but we take too much healthy tooth structure, and also thinking of the chairs time, half an hour for actually not getting much and knowing that you could do bigger treatment, and also putting a watch and wait on it, which you say, okay, but I hope this patient comes soon enough. And if not, knowing today that this can cause also severe diseases. Today we know that it is 26% increase of mortality because of cavity infection. So this was where we were really searching to close this gap. And now we have a restoration of actually for these small cavities, which is non-invasive, and the tooth makes its own filling. So this is what is the best thing.
It's incredible.
Yeah.
So first of all, I mean, I have, 3 children. But I've had 7 through foster care, and of
Oh,
course, take
beautiful.
them all to the dentist. And the dentist that I was going to didn't offer Curedont, and they put my kids on a watch and see, 2 of them. And sure enough, the next time I came back, they had cavities, and we had to go through, drugging them and to everything else, and it was awful. And I talked to them about this, and there was so much resistance, which I found to be just absolutely ridiculous. And for me, it just means I'm going to change. I'm going to find a provider who offers this. Why would I trust you if you're not willing to offer me something that I'm telling you could be another option that is obviously working? So, what are you guys finding with that?
It's, it's awareness because we as doctors, we only want the best for our patients. But if we don't know anything about this technology, that's why we're cautious and don't want to use something where we don't know enough about it. And this is the reason we are growing our team very fast to exactly bring the awareness, because we see as soon as we educate the dental professional, they all want to start with Curedont, none of them, because this is also our duty as doctor. If we have a patient that has an early cavity or early decay, and we know that there is now a technology that can treat it, and we don't even offer it, at the end, it's the patient that has to decide, do I want to do it with Curedont or not? But if they don't offer it, it's because it's our fault. You're speeding up. We are now in 20% of the dental offices since after 2 years, but still, we still have to do some work. And we're extremely grateful that you are giving us your platform also to speak about it.
Yeah.
And I
Absolutely.
believe also another thing which regarding the awareness, a lot of the dentists who have not seen it yet or heard about it, hearing this, they think, oh, this is another prevention. And this is exactly what it's not. It is really when prevention has failed and it's already deeper. And this is also why we close this gap of care and we can use the whole as a restoration. And what is beautiful that also regarding ADA coding, there was also a gap in the code of ADA. We had the prevention codes and we had the restorations, but we never had actually a code for a non-invasive restoration. And creating a code 2991, which is actually medical. It's a medication to regenerate hydroxyapatite, and it's a restoration code.
And for those that are listening or tuned in late, we are talking to some amazing clinicians, Dr. Goly Abivardi and Dr. Haley with vVardis, and we're talking about their revolutionary product, Curedont, and their journey about having this mission and vision for children and treating early detection of caries and other things. And really do appreciate you both on here. And also, before we keep going, I want to thank American Dental Institute, who is our co-sponsoring our podcast and are great friends of ours as well. Really enjoying this and really want to talk about the work you're doing because it is revolutionary in dentistry, being in the field about 20 years on the back end, putting in dental implants and things and working with adults. But it all starts with the children. And it's not just about filling a space or filling a tooth, right? As we all know, it's the confidence they get or non-confidence if they have caries or they have decay or they have inflammation, and we know it's so important. So again, I just want to applaud you all, and I know the industry is as well in your growth and want to keep promoting what you're doing. So again, thank you on that. And it is about education. I'm coming from education, and what Julieanne and I do as well. So awareness, education, like our platform at these other events, and just so you know, we'll keep making sure we applaud what you're doing and sharing that as well. So Julieanne.
Yeah. So, just talking, going back to the awareness thing, I think I heard a story, and you guys correct me if I'm wrong, but I think I heard a story about how you guys started the marketing maybe even before you had the permission to do the marketing. Was that, or did you guys go get permission for the marketing right out of the gate?
No, this we were talking about
In Switzerland.
Switzerland for our DSO, the first DSO that we built, we founded in Switzerland. And at that time, marketing was not allowed yet. This was about 20, how many years,
In
Heidi?
healthcare.
25 years ago.
Yes, long time ago.
Yeah, a long time ago. And there we could convince, so we didn't do anything before it was not allowed. So we were able to convince the health department to legalize marketing. And so we did the first awareness campaigns for early intervention and so to bring the patients in. And we were very successful because after 3 years we had already, yeah. So it grew then very fast, our new concept.
But you guys had, I mean, you guys have basically had to play with legislation. I mean, you had to go and get them to change the law,
Yes.
literally
Yes.
change the law so that you could have an effect. I mean, what was that like? I mean, you have done so many things that have been so significant and have had literally an impact on this world. And so I can't even imagine what's next for
But
you.
Julianne, thank you for saying that. At the end, it's not us alone. The great thing is that we're meeting every day people with hearts that, again, want to help us for this mission. And that's why we're also extremely grateful for our team. So the way we choose our team is, of course, they have to be talented experts in their area, but they all have a great heart because
We have even in our office
yeah,
the heart. That's one of the most important thing for us.
yeah, so because we all have the same mission, and that was beautiful, Michael, what you were saying. It brings back confidence, dignity. That's why we also initiated an awareness campaign. We found out that until today, no one speaks about cavities. There are no cavity ribbons. So we initiated now the cavity Save Teeth, Save Lives campaign because is connected to the whole life of a person. It's a turquoise ribbon, which we are now want to bring the awareness, especially to there are so many mothers that don't know that they cannot treat non-invasively their children, to bring their children and sign the consent and bring them to the dentist.
I love that.
Yes.
That's so incredible, and that is gonna, spread, right? And spread awareness. It's gonna
Totally, yeah.
spread
Yes.
the intention, the heart behind
Yes,
it.
this year in San Francisco at JP Morgan Healthcare Conference, where globally everyone was invited from the whole world. And Goly and I were invited to speak on stage, which is actually very rare for a non-public company, and wore both of us this and went to Jamie Dimon. Jamie Dimon said, "This is great." We took a picture together with him. So that was the first thing. Okay, now we're gonna go and slowly spread this around the world.
We're huge advocates of what you're doing. Obviously, service coming from the heart. As Julieanne said, we formed our company as Friends First, and we're highlighting in our magazine influence, philanthropic ventures and giving back, and we totally ingrain that in what our mission and vision is as well. And obviously, you're doing that as well. So, again, any way we can support you or any of your organizations that do outreach for underprivileged children
So
or
kind.
getting that word out,
Thank you.
we're happy to do that, whether it's at events or others. We're friends of yours and friends of vVardis and your product Curedont on what it's doing. So
Mike, they're gonna be on our cover. You know that, right? Yeah, so
Thank
we
you.
would love to have you on the cover, and do a story
you so
on you, an
much.
entire spread. And I think we have you queued up. We've been talking with your team, and I don't know if they've communicated it with you, but we have you queued up, I believe, for our fall issue. And that goes out to just everybody in the community because again, we
Wow.
built that. It's free to anybody in the dental community. That magazine Influence for Dental Professionals has never been done before, where we address lifestyle and mindset in the dental space. And so we have, even the advertisers are sharing it with their databases as a free gift in their newsletters, and it's going out by all of the influencers. So I cannot wait to have you on the cover of that. Not only is it going to be
Thank
gorgeous,
you.
But I don't know how much you guys hear about yourselves, what's murmuring around there, but you
No, we
have
don't.
you have really become sort of an example of lifestyle in the dental space. And so you're dressed the part, you look the part, you have all these things, but mostly it's coming from this mission driven type of work.
Nice.
And so
Thank you. This motivates us so much. Thanks so much.
yeah, I mean, it's just really inspiring to see that people in the dental space can go out there and be representatives on a level that is really beyond dental. Because for a long, long time, dental was so structured under this very technical field. And now we're seeing that it's having a greater impact and it's starting to cross over into other industries. You guys are leading that really in so many.
Because you're forward facing, right? You embrace that. And again, I'm going to call it celebrity, but you embrace that mission and vision to share. And from the heart, as Julian said, and for children to give them a chance, and that's really appreciated. But I also want to kind of move a different direction with this conversation regarding that you're both very successful women. I have a daughter. I'm very proud of her. I want to empower her to live her dreams, to be the best. If she wants to run a company, run the world, go for it, right? Julieanne has 3 beautiful daughters as well.
Right.
So can you talk a little bit about that, about being women in this industry, doing what you're doing, being a role model for not only women, young girls, but men? Obviously, it transforms or transcends. Tell me about that angle on, do you feel an obligation for that to kind of be that, or is it just part of who you are, but kind of that angle?
Well, Michael, since we are already older, I would say at our times it was very rare for adult women doing a business or even creating a DSO. But at that time, we didn't even know that we were creating a DSO. We were in our early 20s and work was just day and night on one, but we still having also our mom as role model. We still had also our children, family. So I have 4 children. Goly has 2. And what we tell everyone and also women, and if you have a dream, go for it. And one can combine family and work. And it's even good for the children to see that you do not get everything just on a plate. If you want to, you have a dream, you need to also work hard for it. And not everything is just normal. And you need to know that there's so many times that you're really down, really on the ground, and you have this feeling, oh my God, can I at all get up again? And we had
Like
this in
yesterday,
our
Mike. Yesterday was I not I'm not even kidding when I tell you I was sobbing on my couch and Mike talked me off my ledge and I said I don't know when I had a meltdown like this before, but there are times in business where it's really tough. But I'm like, you guys have had breakthrough moments, right? And where I'm curious when you went, "Oh my gosh, we made it." Like have you ever had that moment where you're just like, you know?
We did have, but we had to, at the end, it's also, so going back again to the daughters, I have 2 daughters, and for them, they say, we are so proud of you. So in the beginning, when there were children's younger, of course, their mom wasn't so much at home. I was not able to do all the homeworks together with them. But now they're also appreciating. They say, well, we became independent because you were working so much and we learned that we had to do ourselves and go through the difficult times also ourselves and when they were younger. And still now for our mom that was also always working, she's now our best friend. So it's even if we didn't see her. And yes, up and downs, a lot of up and downs, but a lot of so my daughters, they call me mom, you're like New York, the city that never sleeps. So because there are downs that we cannot sleep, it's not that we cannot sleep because we're worried. We are the type that as soon that there is something, we start working to to stop the problem and to find other ways.
And Julieanne, we had also, in our, we did multiple actually companies from scratch together, Goly and I. And the biggest was the DSO and also a product company, which went globally. But all of them we did, we were in our 20s. So we went in with everything we had. We put together 100,000 and got a 3 million loan from the bank and began this business in our 20s together. But we had moments where we were like going bankrupt and knew we were losing everything, and then just didn't give up and got again a way to go up again. And this was also one of the things that when we were not anymore in our 20s and we were already, I was in my 50, Goly almost 50, with vVardis 6 years ago, where we said we sell everything and put all the proceeds from this sale into vVardis, because there's no one that is taking this to commercialize it. And the big companies, they do not want to take the risk, because for them, coming with a new product in an industry where cavity management, the last innovation was 70 years ago with fluoride, they saw this as a huge risk. And we spoke together and seeing also these homeless and all these things, what can happen, what impact this can do. We said, Goly and Elisa together, you know what? We don't care. It's not about money. It's about really doing something good. And we sold everything, put everything inside, taking the risk that we can lose everything. And everyone said, are you crazy? You're already in your 50s. You can now just relax and just enjoy life and retire. But this was the moment where we said, we need to do it. The big companies are not. Who will do it if we don't?
Wow. I commend you, and Mike and I are in the same boat. And, it's so interesting because when we decided that we were going to go all in on building a company that was about lifting up the voices of the most influential people who were lifting others up. That was our goal. So we didn't come into this and say, let's build, let's build our influence. That was not even a thought. We were just like, let's lift up the voices of influential people who can create change and shift
That's
this
so
planet.
important what you're doing. So important, because you bring also awareness and give motivation to the others. Nothing is impossible. Everything is possible, but you need to work hard for it.
Yeah, and there's some risk, right? And I think that's something that you come across a lot in dental, where people are struggling, right? And we private coach high achievers, so we tend to focus on high achievers, but periodically we're out speaking, and we have people come to us, and they're really down and out, and there's always a possibility to shift things around, to change things. But you do see this tendency in dental where people are very concerned about perception. And so if you lead with perception and you don't lead with the impact or the desire that you have to help people and the desire that you have to give back, then it is very sad. Like, it's a very lonely existence, because the perception is not going to last forever. It's there. Don't get me wrong. There's a legacy place. Absolutely, your perception will last forever. But you didn't lead with that. You know what I'm saying? You went out there because you wanted to give back. I'm very curious what is in your path right now that you're unfolding. You hit 20% of the market already, and that's significant. That's in some people's world, 2% is significant.
I should say it is for us, it's still going too slow. And
Yeah.
then last time it was about a couple of months ago, where someone told us that does all these analytics and so said, this is incredible. We said, are you sure? Is it? Said, do you know that in dentistry, if you look at Align or Straumann, even after 10 years with a huge amount of team, huge amount of marketing, they didn't get even 10% of the market in US. And we said, that's good.
Now, And I,
Massive
yes,
impact.
and I love that though, that your mindset is 20%, that's minimal. We want to do 30, 40, 50, 60, 90. So I love that. I love that vision and that confidence to say 20 is okay, 20 is a number, but we can do more because you can't do more. There's
There's so
80%.
many people who need this technology. It's only 20%. That's, yeah.
And
Exactly.
Michael, I should also say, we really found out it's only the awareness. If you go to the dentist
Yeah.
and you tell them, look, you can drill these small cavities or send them with watch and wait, or you just take this little sponge, 3 minutes, and you can do it. We are not selling a product. We are actually selling a dream that all dental professionals were looking for, a solution for this problem. What shall I do with these small cavities? And this is why it's a nice thing to really give out and go out. And this is why it's a no-brainer. It's a win-win for everyone. It's a win for the patient, win for the dentist, win for the insurance.
And we didn't do it ourselves. The support that we received from the academia, from universities, we're already in so many renowned universities as standard of care to treat early cavities. And then and then the professionals, they're calling themselves curodontists.
What?
Curodontists, that's with the mission to save teeth and save lives. So somehow everything, this product, this technology, this mission created a movement to be proud to be part of, this non-invasive movement in dentistry.
I was going to say, so I love that you're saying that, and I love that they're calling themselves curodontists, and we need 100% saturation with this. But that said, one of the things that Mike and I are big fans of is leveraging influence, right? So when you have good people, the more we come together, the more we support each other, the faster we can actually have that impact. So who are some of the people that I know that just even if you look at aligning with companies like Pearl, where the diagnostics are not just, your typical x-rays without some further evidence, or other companies that are doing innovative things, how are you guys leveraging influence by working with other people who have an impact and have a namesake and that type of thing right now?
What is beautiful is also the timing, since AI is getting more and more coming into the offices. And what is nice is these small cavities. I mean, we see it with our eyes on the smooth surface. We see it interdental on the X-ray. But for the patient communication, if you have the AI and suddenly the patient sits there and they see these red spots, you are not the bad guy telling the patient, you have your cavities. The AI does the work for you. And then telling the patient, look, you have a cavity, because as I before said, it's already, the prevention is already too late. So it is now a cavity there. And you say, you have a cavity here. We can make an appointment to drill it, or we can do it just now with Curedont. And by the way, it costs the same. Almost all the patients say, please do it now. I'm so happy you can do it without numbing, without the whole drilling, and with no stress. So this is the beauty about combining these AIs. And what we are now doing, seeing that not everyone has AI or do not know if I take it, we are doing a package that when you get Curedont, you get also the AI for free. So you can try it out and see how it works.
That's amazing. I believe, like Julieanne said, leveraging influence, strategic partnerships, we can all go further together, right? Dentistry is a team sport, and I come from a team sport, and it's more fun that way. And I kind of want to shift gears a little bit as well, because this is phenomenal public service. I agree with Julieanne. But you mentioned your families. It looks like you guys are enjoying life. We can get back into this before we end, but I want to know what you all do for fun. What do you do for fun? What do you do for enjoyment? Obviously, you're working hard. I think people should also play hard or enjoy themselves as well. So if you guys could share with ourselves and the audience, what do you do for fun with your family or by yourselves, or what makes you guys have fun and laugh?
Well, Actually, as you said, we are most of the time now on the road, in the plane, and going. But when we have time, it's really quality time with the family. What I love to do is the Sunday brunch. I love to do the egg and bacon and pancake for the whole family, and they all know, okay, on Sunday, mommy is going to cook.
But I love food as well. Obviously, if
Yeah,
people have met me and seen me, I'm a big guy. So I love brunch, and my mother's passed on now, but we used to, my family, my grandmother, holidays and Sundays were all about family and brunch and food. And
yeah.
that brings a smile to my face. So thank you. That is nice that you're able to take out those times.
And you inspired me because I love to take my girls to tea, like where they get to go to a tea party at a tea spot. And so you just made me think about it. I'm going to actually schedule it for this weekend. So,
There you go. So you motivated you.
what about you, Dr. Goly? What do you do for fun?
Well, actually, also, when I have time, I want to spend with my family. And for myself, actually, I love singing, but I don't have so much time. So I just sing.
Oh,
She
But it's not-
actually sings amazing.
No,
What
no,
was
that's not true.
no, I should say, when I was
No
a
way.
child, I mean, I was in the second, no, what in the primary school. I didn't get into the parties. They didn't want to, and so I always said, "I'm gonna bring my sister. She's gonna sing." And
She's beautiful. She can like
no,
what do you say? Paint beautifully.
yeah,
yes,
they're both artists and so I come out of entertainment. I don't know if you guys know that, but I have a Super Bowl commercial that went viral. I come from the acting side. And so I wasn't a singer, but I did do the a little stage stuff at a few times in my life.
well,
Back.
Golly actually, she did the song "Safety Save Lives,"
I didn't sing it myself. It's only
but she put it
so
together.
we have our own song for our mission.
That's
Yes.
amazing. I want a song for our mission, Mike.
Well, no, but I do want to hear that, or we can post that on our website. Please do share that with with
So
our
we have
audience.
written ourselves the lyrics, and we created together with, thanks to the AI, we created then the song and the voice and everything. We
Incredible.
did it
And
ourselves.
I would love to actually, we should add them to our website. Share it with us. We'll also share it on our social media. And then we would encourage our listeners to share as well, because this is really incredible work that you're doing. And I know we're coming down to the last,
Yeah.
maybe 10 minutes or so that we have with you, but I want to make sure that we don't leave anything unaddressed in terms of what you guys are working on and where you could use support. Also want to make sure that our listeners know where to find you and just kind of anything that's been unspoken so far so that we make sure that we wrap this up completely. And definitely we'd love to have you back on as guests in the future.
Thank you.
Thanks so much.
Yeah, and regarding that, it's about that vision and mission, and what our listeners have heard, or what I've heard as well, is if you have a dream, you have a passion, to go for it. And I think it's very noble as well regarding working with children. And one thing I was going to say is your technology, your company, obviously it's early detection for children, but you'd mentioned the homeless and adults as well. This is for
Absolutely.
anyone and everyone. It's not
It's
just for
for
children, it's for
everyone.
everyone.
It's not only for children. And this is, I mean, also adults don't like to get drilled.
Right.
And also dentists do not rather spend their chair time half an hour on bigger treatments than on these small cavities. So this is the beauty of it. And 80% of all patients sitting on the dental chair have around 2 to 5 small cavities. Did you know that? So we are not speaking about a new niche market. We are speaking about a category which is huge, and we didn't have a real solution for it. Because for these small cavities, thinking of sealants. Sealants is great, but it works only on the surface and not interproximal. And these small cavities, also almost 80% of it are between the teeth. So this is why it's really something that was needed. And we are so happy that it's here. And we are so happy, as Goly said, that we have also all around us, all these supporters, including you now, also bringing this awareness. And our amazing team, going back to your question, Juliana, we are now really growing our team because, I mean, in the first year, where we began really 2 years ago to begin in US, we had only 4 sales reps. Last year, an average 11. And now we have in the US already a team of about 80, where we are everywhere helping and also going with trainings, webinars, key opinion leaders. Also, as Goly said, in already 26 dental schools as standard of care in the lectures to treat these small cavities. So we are so grateful and blessed
And
that really,
I want
we
to
always
chime.
say, pray to God and say, thank you, God,
Yeah.
that you are helping here us on this mission.
Yeah,
So
because we believe everyone deserves to keep their natural teeth and everyone deserves to live without pain. And that's what we will work for it always, day and night, to make non-invasive dentistry really accessible to everyone.
But what
I
is
love
now
that.
important here is that what is also, it is not that the dentists have no job then afterwards. The opposite. It is the opposite because, as I said, 80% of the patients have these cavities. And when you treat them every 6 months, every year, a new one comes. And the mind we are seeing really these dental offices, they're saying the patients are running into our offices every 6 months and saying, can you please check if I have a new one? And these small ones, we were not doing anything really with them. Let's concentrate on the big treatments, do these small ones, or even give our dental hygienists to do it, that we have more time for these more bigger treatments that are more difficult and can also take more patients in
Yeah.
short time. So this is the beauty about it.
Yeah, so I actually am a KOL, a key opinion leader for your guys' company. I don't know if you guys actually know that. I speak about you all the time.
Thank you. We didn't know that. Thanks so
Yeah,
much.
so I speak all over as well as to dental schools. Mike and I have both spoken at NYU to, all over the place. And I've most often get asked to speak on case acceptance and also the secrets of the most successful dental practices. And so it's very easy for me to weave this in as a trust builder because for me, it killed trust when my children were put on watch and then they came
Yes.
back and had cavities and this wasn't an option and that was not helpful for my dentist to maintain me as a patient. I do appreciate everything that you guys are doing. I think it's so significant. I can't even imagine what your dreams look like now because besides getting even more saturation in the market, what else do you guys secretly talk about behind the scenes? Man, if we could just whatever. What is next? What is a bigger dream that you're working on simultaneous to this?
Well, first of all, as Michael just said, 20% is still too low. We would love to have this as standard of care in all the offices in US and also globally. And this is what we would love to have, but we are working also on other products already on the new pipeline.
Amazing. Will they be consumer facing or for dental
No,
practices still?
no, we are really
Professional.
focusing on
Okay.
professional. And what we are looking in is being able to treat also MIH, being able to treat also fluorisis. So everything which is actually already genetics, and we are seeing great results, but we will keep you
Yes.
posted.
No,
Can't wait
awesome.
to see what you have next. You guys I'm so excited right now to have you on the show. I'm so
Yeah.
thrilled for our
Thanks.
listeners to get to hear, everything that you're sharing. It really, truly is inspiring to me on every level. Do you guys work with a nonprofit or have a nonprofit for some of the people that are currently, in need and can't even afford
We
care?
work with nonprofit. We also, yes, support nonprofit
Yeah, I figured you probably do a
foundations, and
lot.
yes, we do. But for us, it's never enough. So
I get it.
Yes.
the more we grow, the more we would like to also give back. So this is a very important part of our mission.
It's an
Yes.
endless journey.
Yes,
The
the first thing that Goly and I would do, because now we put everything into this company. If we could have a foundation where we can really give to everyone who does not have access to the product to really to give it around. This
Yeah.
is for us very important.
So we are supporting other foundations, but we don't have our own yet. So this is, as Hedy said, that's what our next goal would be.
And
Oh, so
what
The
you do
dream.
want to do that? Yeah. So sometimes I go back and forth. Like, do you just keep supporting already established foundations, or do you create a new one? Right? Yeah. And
Own established, and then also, of course, treatment of, yeah, there are so many different organizations that doing
they do
amazing
such a good
things.
job, right? And they have
They're
a
doing
foothold already.
amazing, and however we can support them, that's what we're doing.
Yes.
And as
Yeah.
said, this is not enough yet for us. We want to keep,
No.
and that's the growth. This is why important is for us to really grow, to be able to help more.
And I agree with that, and being the mission and vision to drive commercially, but also to give back as we all do. And Julie and I are talking about foundations we're talking about, and she's been very involved and instrumental in foster care and underprivileged children. And so I think that's one that we're going to continue to push for and grow as well. So who knows, maybe down the road we can have some collaboration on that end as well. But I just I just really want to thank you again as we're wrapping up. And I know Julieanne always asks this, how can people reach out to you either individually or through your company, a website, social media, and other things on how they can reach and know more about vVardis as well as Curedont and you will.
So on our website, we have everything, but then of course we have also our customer care contact where they can
Yes.
write and emails, and we are very fast. Our team, we have amazing team. They
Yes.
are very responsive.
Yes. And we have them now almost in all the states. So we have regional managers everywhere.
That's amazing.
We
By the
are
way,
also most of the actually shows and conferences we are present. So we are happy if anyone has a question or wants to come and to speak to us. It's great. We would actually say come and visit us all. So anytime when you're in Switzerland, but most of the time we're now in US.
we got to coordinate when you're in Switzerland to
Switzerland,
come
yes.
see you.
Yeah.
But we do see you when we go out to the shows. You're always accessible. You always are so gentle and kind. And your team is phenomenal. We've worked with
Yeah.
everybody from Sunny to you. I could just list all of your team, but they're all fantastic. Yeah. So everybody, when you're out there, make sure you hear these ladies speak.
The team, our family, we call them our vVardis family. That's how because we're
Yes.
spending most of the time with our team, so that's why we are so connected.
Absolutely. Well, we really appreciate you being on the show today. Thank you so much. You can find Michael and me on Instagram at Influential Dental. And
Beautiful.
definitely, again, a shout out, thank you to American Dental Institute, who will be having an event this year also. 2026.com is the website if you guys want to check out their event where they bring in dentists from all over. If you guys want to send anybody to that, we'll make sure you're connected with them. And they put on an incredible event that just gives some of the future of dentistry, the secrets of, the most successful dental practices, that type of thing. It's both clinical and also leadership. And so just a
Amazing.
pleasure having you on the show.
Yes.
Thank you to all of our listeners. Without you, it's not quite as much fun. So we really appreciate everybody who tunes in and shares the show. And Mike, thank you for being an awesome co-host as always.
Yes, thank you as well. And again, thank you very much, Dr. Haley and Dr. Goly. It really was a pleasure. You've motivated a lot of people, including ourselves, on this podcast. Continue your great work, and we look forward to our conversations again in person and through our magazine and on the show again. So again, thank you very much. Safe travels to the U.S., and we appreciate your time.
It was a great pleasure. Thank you.
Take
Thank you
care.
both. Bye.
Bye.